Welcome to Deuk Spine Institute. I'm Dr. Deuk. We'll be performing a right piriformis muscle release. The piriformis muscle is deep in the buttock. It is one of the 30 causes of chronic back pain. The way you diagnose it is pushing on the top of the buttock, and you have severe tenderness. It can affect the sciatic nerve. Sciatic nerve runs down the leg through the muscle. And people get a tear in the muscle from bending and twisting. And once you get a tear in that muscle, it never goes away. We do shots, we do all kinds of things, but that doesn't work. So what works? Releasing the muscle. And that's what we're going to do. We developed a minimally invasive way of releasing the muscle in a very safe manner. The muscle can be released anywhere from its attachment to the sacrum medially all the way laterally to the attachment to the hip. The safest place to release the muscle is the hip. Shot. All right. So, greater trochanter is not very well developed on her. We're a little higher than we need to be. My diagram was a little too high, but hey, that's okay. I don't have x-ray vision. I use my machine for that. You can almost see the muscle. Shot. Jordan, can you, I think we're off on the angle or something. I'm not sure what it is. See if we can find it. Not that angle. It's the other way. It's tilting forward or tilting backwards. But which one do you normally do more of? Shot? Yeah, see what I mean? So which one is it? Shot? What do you think, Jordan? No, I think that's good, but do you think is that the proper way to view it? Or is it too much pointed north? Or is this, let me ask it differently, is this what Dr. Patel does? Straight on? Shot? All right, we're going to make an incision. It's very odd. Shot. I think that's going to be the right spot right there. I'm going to make an incision. It's 4 millimeters. The nice thing about this particular surgery is that it's minimally invasive. It's done with a 4 millimeter incision. And if you have this done elsewhere, the surgeons are typically orthopedics, and they will slice your buttock open in a bad way, like really slice it open, and you don't want that because it's permanent damage to your gluteus muscle. Well, let's see where we are. Shot. All right, so I've got to find the right spot. Everybody's different, by the way, but their muscles attachments are going to be pretty much the same. Okay, so whether you have whatever your anatomical variation is, the muscle attaches in the same spot. They're the sacrum, anterolateral border, and the greater trochanter, superior, posterior superior, and posterior facets, which is where we are. Okay, we're ready to get started. Any questions?
At this moment, no current questions.
All right, I'm going to release the piriformis muscle now off the top of the hip. All right, I'm at the back of the femoral neck. Shot. Now you don't ever want to go further forward than the back of the femoral neck. You don't need to go any further forward. You need to go up high enough. Okay, I can feel the posterior facet right there. Shot. It's perfect. And you just want to walk off the medial wall. 2 minutes and we're done. Dr. B.
Thank you. You're doing great.
Yeah, thank you. Patient's doing well. She's had a lot done, right?
We're not going to give her any Toradol.
That's fine. I think that's a wise decision. Any questions? Because we're almost done. And when we're done, you had a lot done, and it's gone very well for her. It's better than I expected, to be honest.
At this moment, no current questions.
You can hear the muscle fibers being released.
Yes, we can.
Like a twang.
Yeah.
Just want to make sure I get them all because I don't want her to have to come back. Shot. And you kind of have to pick your spot where you want to start, and then you work your way up and down, but mostly up from there. All right, we're done. So I feel good about it. Let's see the tape measure. You can see a little pressure. So we did the Deuk laser disc repair, 7mm incision. Deuk laser disc repair, 7mm incision. We did the Deuk plasma rhizotomy, 4mm. The sacrum Deuk plasma rhizotomy, 4mm. And these are the facets. And then we did the Piriformis release. It's a 4mm incision. So, great job, everyone. Thanks for joining us. Any questions?
No current questions.
Our last patient is a Deuk laser disc repair, 2-level lumbar.
Yep.
And that will be our last patient for today. We do have a big case on Thursday in 2 days. You're going to see me do as big of a surgery as we can possibly do in spine surgery on the cervical spine. It is an occipital cervical thoracic decompression infusion. I'll be putting in a metal plate onto somebody's back of their skull, and then lateral mass screws in the subaxial spine all the way down to T1 and T2, where I put in these thoracic pedicle screws. We'll do a decompressive laminectomy for amiotomy. So it's a big, big surgery. She has severe rheumatoid arthritis. She has basilar invagination and subaxial stenosis in the entire cervical spine, but particularly at like C3-4. And we have to stabilize her and keep her from progressively pithing her spinal cord from the basilar invagination. So it's going to be a big surgery. It'll take me 2 hours to do, and it's going to be outpatient. All right, thanks for joining us.